Our friend Dr. Dennis Norem from Mercy Health. Dr. Norem, good morning to you.
Good morning to you guys.
How you doing this morning?
Doing well. So far, staying healthy, so can't complain.
Excellent. Now you've been forced to do a little social distancing just to recover from a little knee surgery too. So this has made it a little easier for you not wanting to get out and about.
Well, I have returned to work on a part-time basis just to kind of help out. Things are a little bit slow at the office as we are social distancing. We are trying to do telehealth. We're trying to keep anybody that has any suspicion for respiratory illness away from the office, but there's still plenty of work to do.
You mentioned social distancing, keeping people out of the office. I think one of the biggest things people are concerned about right now is when to pull the trigger of actually going in to see your doctor. Before you do anything, a call right?
Yes, call your doctor's office and discuss it with them. We have a screening protocol to go through with the patients to make sure that it's something that absolutely needs to come to the office to be seen, that it's not, or if it is a situation that needs screening for COVID-19, as we may have mentioned last week, I think all the health systems have set up screening methods, drive-through screening that they can do for the patients. If someone appears to be very, very ill, then we may send them to the emergency room, but we'll let the emergency room know ahead of time that these people are coming.
All right, so make that phone call first. Don't show up unannounced. Make it easier for everybody, including yourself, by making the call first and working those things out.
Is the first call should be to your primary? Who exactly should we make that first call to?
Your primary. I understand that, most people have a primary, some people don't. If you don't have a primary, again, as I mentioned last week, the health systems have hotlines that you can call. You can call the emergency room itself and talk to somebody who can give you some good advice as to what to do.
Dr. Norem, for people, we hear this all the time, that person's been screened, we'll have testing, we'll screen that person. What is the screening process? How does that work and how long does it take?
Well, it's improved somewhat. In our office, if we determine somebody is appropriate to be screened, we will send them over to our Perryville office and, in essence, have a drive-through screening. That's assuming that they're not ill enough to need to be in a hospital. The turnaround time has improved. I'm hearing numbers of 3 days, maybe less at times. If they go to the hospital and have to be admitted, the turnaround time is much quicker just because that's a priority.
Is it a cheek swab? Is it a blood draw? How is it done?
Currently it's a swab like you would for strep throat or for the flu, where it's an oral pharynx, swab through the nose, swab through the mouth. So it's a fairly simple, not very invasive test, and it's easy. Everybody's had flu swabs, strep screens in the past. It's very similar to that. What we're all looking for is the blood test that would tell us immunity. That was just approved by the FDA, I think, this last week. That's not commercially available. I actually called two of the large labs, Quest and LabCorp, and asked them if they had that blood test available to tell if you have had COVID-19. It is not yet available on a commercial basis.
One of the big stories is the number of tests that we have right now. I know we'll probably never get to the point of having enough tests for everybody who wants a test, but are we right now at appropriate numbers for everybody that needs a test? Everybody that needs to get tested is going to get tested in the area?
I would say that it's improved. It's still not to the point where we could test everybody we would like to test. We're still a little bit limited on that, and hopefully this rapid testing will change things dramatically. Part of the problem, of course, is if you have a 3 to 4 to 5 day lag to get your results, it makes it very difficult to know what to do with the patient while you're waiting for the test, other than obviously we tell people to quarantine at home and stay away from everybody. once this rapid testing becomes readily available, I think that will make things much more straightforward and easier for us to deal with this.
And just to follow up on the rapid testing, you've been around this for a while. I'm not asking you to tell me a date it's going to happen, but this rapid testing, do you see that being available within the week, within the month, within the year?
It's probably going to be available within a week in certain places. Abbott Labs announced last week that they were shipping out 50,000 test kits a day. And their priority, I think, is to ship those to the hotspot areas. So it's going to take a while to filter down to areas that aren't nearly as affected. One of the issues that comes up with that test is that you need equipment to run it on. It's not just the test kit itself, but the equipment. And apparently, some of the newer equipment that Abbott manufactures, which is already in place in many labs, they can run that new test on it, but not everybody has the newest equipment. So some places need to get actually new mechanical equipment to run that test. So it's going to take probably a few weeks to even longer for some areas of the country to be able to do that.
All right. We're spending some time with Dr. Dennis Norem from Mercy Health, and just getting your take on some things. It's gone back and forth, and Joe and I talked about this earlier this morning. You've got one side that's saying, oh yeah, everybody needs to put those masks on. You have another side saying, no, that's not really going to provide us with the coverage that we think that it's going to. What's your opinion? What's your take on the on everyday use of face masks?
Well, I think after that recommendation that came out this past week, if you're going out, you should wear a mask. And again, the issue is you're protecting other people from yourself. You're probably not protecting yourself so much. You're protecting other people. In order to protect yourself, you need a much more sophisticated medical-grade mask, the N95 at a minimum. But there is some good evidence that wearing some kind of face mask will protect you from, or protect other people from receiving the COVID-19 virus from you. And there was some discussion about, well, what constitutes a mask? You see a lot of people making these homemade masks, which is great. The recommendation is the thicker the material, the better. Probably cotton material, felt-like material is better than synthetics. A lot of people wear bandanas, for instance, and the bandanas are probably too thin, so if you're going to wear a bandana, you probably need to double it or triple it. And obviously wash it as often as you possibly can. But there seems to be some evidence that that is beneficial to stop the spread.
So ideally, people have an N95 mask, but if you can fashion one at home, it's better than nothing. And you would recommend going out to high concentration of population, your grocery stores, your drugstore, something like that. Right,
the places that you absolutely have to go to get your food, get your medicine, and again, not to be using medical equipment because, as we all know, the PPE is in short supply. So we really need to limit that to healthcare providers and our emergency responders who are in this day in and day out.
Would you recommend mask usage for just a walk around your neighborhood? Things by yourself. We have seen people do both those. And as we said earlier, if it gives you peace of mind, go ahead and do it. But is that a necessary procedure for safety?
I suppose if you could be absolutely sure that you're going to be 6+ feet away from everybody by yourself, it's probably not absolutely necessary.
Excellent. We appreciate it. Dr. Norem, have a fantastic day. And again, thanks for your time.
Yeah, and be safe, you guys.
We appreciate it. There's Dr. Dennis Norem from Mercy Health.